You see, people make it look like when you go through CS, you went through the easier route. You didn't feel the pain, and so it makes you less of a woman. But in this video, I'm going to let you know the pros and cons and what it means to be a CS mom. So today, I'm feeling mama. So I'm wearing rich auntie this thing. Welcome to GenZ Moms Connect. I'm Mrs. Chawe, and I'm glad to have you here. In my last video, I talked about my journey, how I had baby, and for my case, I didn't have an option. CS was the only option. So I had to go through it. And someone asked me the last time, will I love to go through the process again? And I boldly said, yes, with full chest, because that is what I know. And it went well. Why should I go and taste something I don't know how it will go? At least this one, I've done it before. I know road. Let me follow that one. The other one, the other people can deal with it. So what the process in itself, I think, was about 45 minutes to 1 hour. I don't really remember, but it wasn't a long session. But I believe some people have longer sessions because of maybe complications that set in. And when the anesthesia wears off, when you come into real life, then they come and deal with the pain. They cut through various layers to get to your womb. A medical doctor will do that job. My own is coming to talk about my experience. I wasn't there when they were opening up. I didn't see. So I'll definitely get a medical officer to handle that some other time. But dealing with the pain is something else. After the whole session, in the evening, later in the evening, I was told to manage and walk around to prevent blood clots. That one too, medical doctor will talk about it. So I started trying to walk around, and it was working. Yeah, it was working. After about 3 days, I was discharged because I was well. I was able to walk. I could go down the stairs, come up, go and buy something if I wanted to. Even though my family didn't want me to be doing all of that. Well, husbands and mothers and fathers and siblings, they didn't want me to. But then, I just wanted to stay fit. Moreover, I wasn't in extreme pain to just be lying down. I think everybody perceives pain differently, and I thank God that I went through this quite quick. Let me talk about the loads of painkillers that you will be using. You always have to take painkillers, and the painkillers prescribed are not the regular paracetamol you buy over the counter. You take water and oh yeah, you go. No, you have to be taking painkillers of a higher order just so that you'll be fine. Because I remember I was taking some by mouth, and I was also using suppositories. Yes, that's how bad it is. See, bad with a smile. Yeah, and you do that for some time. Personally, because I was healing quite fast, and I always thank God for support systems. You know, when you have support, your mind will be at rest for your body to heal. But if you don't have support, and my heart goes out to every mother who have gone through this alone, with no parents, with no in-laws, just you and your husband, and it even adds another layer if your husband is misbehaving. But my heart goes out to you. My heart goes out to you because I believe strongly that the support I had from family really helped me. The calls, the checkups, people coming around, it was very therapeutic. As I was discharged, I had to come back to the hospital every 2 days to dress the wound. They have a way they dress it. When you get there, you will know. But every 2 days, go to the hospital to dress it. And in no time, it was okay. And yes, I wasn't allowed to bath though. Not allowed to bath. You told me to wait for some number of weeks. Let me just confess, I broke that rule because how can I live without bath? Just always using towel. But I know people too who bad that they had major complications. I beg you, you are going. Some people use hot water. Please, you don't do that. Hot water, it can melt the thing they use to stitch the wound. So please take note of that. Let me just hammer on it. If you're a mother, or you are planning to be a mother, or even you're just a young Gen Z watching this one, don't go for a CS and then you'll be using hot water. By the time you realize, your wound will open up again. Yeah, so for me, I wasn't using hot water to do anything. Just the normal warm water, or sometimes even bathed cold water. The water was hot too. Hey. So yeah, I broke that rule and then started bathing. But it was after the nurse had told me that the wound had completely sealed. But she didn't give me the go ahead. But if it has sealed, let me just break the rules more. Yeah, so yeah, that's what happened with mine. And so it was quite quick for me. Now, when we talk about CS, there are pros and cons. Everything has negatives and positives. So let me go with the negatives first. The first one is that there is stigma attached to CS moms. It will shock you. Someone will look at you and tell you, you've not seen anything. You went through CS, you were asleep. Those of us who stayed in labor for 10 hours and we pushed out our baby, we are the real women. We are the mothers that they'll be hitting their stomach. We went through the pain. Yes, so the real mothers. And so there is this stigma attached. If you are not strong-willed, if you don't have a supportive family, and if you don't know your identity, these words can sometimes break you down. So you need to be strong-willed, have a strong sense of identity, and then make sure that you have a supportive system. Then you can go through this stigma. Someone had told me before that, even before I got pregnant, that in some societies, people see CS women as people with deformities. I mean, a woman, why should you go through CS? When people are doing the hard work, you're going through CS. That is it too, but here is me. See my rich auntie life. Oh yes, so that's the stigma attached to it. The second point I'm going to talk about is the scar. Yes, a scar. You're going to have a scar on your skin, a scar on your abdomen, the evidence of you going under the knife to bring life to the world. People undergo various treatments to remove those scars. Me, I won't do that. I won't do that. Where it is hiding, nobody sees. Well, people will go through treatment to remove the scars, so that's an option. You will have the scar. The third one is the risk of surgical complications. We all know the issues that come with surgery sometimes, especially sometimes in our part of the world. I used to hear stories, so I've not seen. I was only hearing stories that sometimes they'll leave scissors in your stomach. I don't know which people brought those stories. But yes, so those are some of the risks attached. Sometimes the wound, you will get complications afterwards. The wound may become infected and all of that. That is another negative. The fourth one that I'm going to talk about is the fact that sometimes you have this long-standing pain in your pelvic area and at your back. People have been complaining about that, but I have not experienced it. Maybe I'm not conscious of it because when I married now, I got pregnant, so I don't even know how normal body functions in marriage. I am used to always having something attached to me, so I don't even know how long I can stand before the pain. I didn't know. All I know, it's not easy. But now when I stand in the kitchen for like 45 hours straight, I always have very severe pains at my back and it comes down to my leg. I'm learning to stop standing for that long hours. I don't even know why I do that. Like somebody forces me. Nobody forces me to. I just wake up and I decide to work in the kitchen now from morning to evening. Can you imagine? I will stop. But yeah, people have been complaining about that. So these are the four. Let me add the last one. You relatively will have a longer stay at the hospital compared to someone who had vaginal delivery. Yeah, you will be at the hospital for a longer period so that you can be monitored and all of that. And going through all of these, you still have to be there for your baby. your baby needs you. So sometimes it makes it quite difficult. You are managing your own pain, you don't even know what is happening, and you have to take care of your baby too. It can be quite difficult as well. One thing that helped me, I always told myself that if people can undergo brain surgery and they come out alive, I can undergo this one and come out alive. They go and open up people's head, do can inside, open heart surgeries and all, they come out alive. I told myself, God is with me. I will go and come back safely. And I came back safely. Now, let's talk about the pros. The first one I'm going to mention, I'm shy, is that you always have your ecosystem preserved and kept. When I say ecosystem, I mean the down there. Okay, you please you're a bad girl, you're a bad man, relax. So in the case of vaginal delivery, sometimes there are tears that they stitch later on. So it's like the baby is coming. If you give birth to a baby like me, big head, coming, you are tearing things. By the time you realize, the place has become like distant. Aye. So for CS moms, we escape that one. So our sexual experience, I don't know for other people. I would talk about mine, even pro. So yeah, relatively you have your place intact. So apart from hormonal issues that can cause a decreased sexual drive and all of that, you will have maybe the same experience as you had before you gave birth, because nothing passed there. It was just catheter. They inserted into your bladder. Catheter. After that one, nothing. So you can continue with your sexual life, and it's cool. I think that's a very good one, because before I gave birth, I used to think about it that, hey, these big head people, they are coming to come out, and then, what will happen? But glory be to God, you know. The second point is that because it is scheduled, in my case it was an emergency, but for those who schedule for CS, normally you get the time to prep your mind, to psych yourself, and you look forward to the day. It doesn't take you by surprise. Like I shared the last time on my WhatsApp status. Oh, my WhatsApp status is a place to be. I love that place. I shared that I want my next child to be a Tuesday born, so that we'll be a family of Tuesday borns. And so when I get pregnant and then we are checking out dates and all of that, I can just tell the medical doctor that I beg, I want a Tuesday. Can we fix my surgery on a Tuesday? So you have quite a level of control over when you want your baby to come out and on which day. What I think is good, it gets mothers more prepared, it gets everybody prepared. But the other side of it is that you can also invest in prayers. You know, your mother can attend the all night for you, your husband, you yourself. You can attend, you can invest prayers. So I think that is also a positive one. And then I've said two. The third point that I am going to talk about is the process is relatively quicker. People go through vaginal delivery and they stay in labor for 5 hours, some 12 hours, even 15 hours. But for CS, within 45 minutes to 1 hour, if no complications arise, you are out of the theater. It's quite, then you are out. I remember I said when I showed my baby, they showed the baby to me. Like, is that my baby? My eyes were not clear, but I could see that, hey, why right now? Yeah, so it's relatively quicker. And then the last one I'm going to talk about, how many have I mentioned? Quicker, scheduled, intact ecosystem, and then yeah, done. So yeah, those are some of the pros, and mostly it's a life-saving option. Let me just add that one. It is a life-saving option. If you can't push, don't go and try and push. You know yourself. And sometimes in certain issues, doctors will recommend it. Don't say I cancel it by the blood of Jesus. I'm very sure that if mine had not been an emergency, I would have gotten the same reaction from people around me. My husband was cool with it, but I know African mothers, my mother would have gone to the mountains to pray and cancel every CS, we cancel. Yeah, but I think that it is a life-saving option if you can't push, taking into consideration the weight of your baby, your health at the moment, and sometimes maybe you are just afraid, you are scared of the pain, of the push. Oh yeah, go and choose CS, you'll be fine. Many have gone through it and have come out safe and sound. I thank God I'm safe and sound. I am happy. Many mothers have gone through this. It is not for weaklings. It is not for weaklings. If anybody says that, see me, I'm a child of God, so I'll just pray, God, forgive them, for they do not know what they do. But if the non-Christian hears you say that about her, you will see what she will do to you. She will show you pepper. Me, I'll say that, God, please forgive them. But when any other person hears, you will see. It is not fair, it is not nice to stigmatize a woman who puts her life on the line. Do you know what it means to be wheeled into a theater, to see instruments, to sit up and receive that injection at your back? I heard there is an English name for it. The medical doctor will come and talk about it. Put it at your back. They cut. It's not a joke. But at the end of it all, life comes out. And that is what we are grateful for. So this has been my experience. These are the pros, these are the cons. The choice is yours. But never be afraid. Whether you go through vaginal delivery or CS, one thing remains constant. God is with you. So he says, you walk through the fire, I am there. Walk through water, I am there. Everywhere. You walk through the valley of the shadow of death. So I don't think that the method of delivery is the most important thing here. The most important thing is who is with you. The one who goes through with you is the most important thing. If God is going through with you, you can go through very dangerous procedures and come out whole. And if God is not with you, just an ordinary can kill you. So just trust in God and have a beautiful time in the delivery room or theater.